type of thoracic outlet syndrome you have doesn't matter if you're trying to fix your own pain. And today, I'm not only going to explain why, but I'm also going to go over the different types of TOS and why you're given one or another. Hi there, my name's Adam, and welcome to TOS Treatment. Now, the biggest reason why it really doesn't matter what kind of TOS you have is because everything's getting compressed in the same areas, for the most part. You see, your nerves and blood vessels pretty much travel together from the neck to the arms, all the way into the fingers. So in my opinion, it's not necessarily what kind of TOS you have, it's better to know where that compression is taking place. Now, if that is the case, then why does your doctor diagnose you with one kind of TOS over another? Now, I'm not a doctor, but I'm pretty sure it has to do with the symptoms that you're having. Now, if you were diagnosed with neurogenic thoracic outlet syndrome, then there's a good chance that you're feeling things like tingling in the fingers, maybe even nerviness. You may feel some sort of pain in the neck or even the shoulder. And all this is because the brachial plexus, the nerves, is what's most likely getting compressed or taking most of it in the area that is getting compressed pretty much. Now, vascular TOS has to do with compression in the subclavian vein. This can lead to swelling in the affected arm and make it feel weak or even heavy or even turn like a bluish color. And the last one, which is the rarest, is going to be arterial TOS, which is when the subclavian artery is getting compressed. Now, this can lead to reduced blood flow into the arm, making it feel cold, pain, numbness, and in rare cases can even cause some sort of gangrene effect and make you lose an arm. These are the three types of TOS, and depending on what kind of pain or symptoms you're showing will depend on what kind of TOS you get. Now, let me be clear here as well. I don't believe, again, that it is 100% necessary for you to know what kind of TOS you have if you're doing things like massages and stretches, the things that I like to teach you. But if you are a surgeon and shit like that, then you definitely need to know which one you're having, because that definitely is going to indicate what kind of area you got to cut where into and things like that, right? I'm definitely not a doctor and all that shit, so I don't know. But long story short, when you're treating yourself, when you're trying to do things yourself here, knowing which one you have isn't necessarily going to help you as much as knowing where the compression is coming from. So with that said, let me actually show you the three main areas that is going to create compression on the nerves and blood vessels and show you how to quickly perform some tests for it. And the first area is going to be the scalenes, and the scalenes are located on the lateral side of the neck, and this is the first area where all your nerves and blood vessels pretty much come through. Now, for me, I like to kind of do a very simple and quick test here, and it's what I like to call the tender test. All you're going to do is simply press into the muscles a little bit with about a 5 or 6 pressure level. And from here, if it feels tender, tight, or even creates your pain, then that's going to be a sign that that area may be creating compression on your nerves and blood vessels, and that might be an area for you to address. And the second area is going to be the pec minor, which is located right underneath the pec major and in the top shoulder region. So again, go ahead and feel around your chest in the upper portion to see if there's anything that feels tender, tight, or recreates your pain. And go ahead and give it a nice little push here, because it is deeper to the pec major. Don't be afraid to press into there, okay? I understand a lot of people aren't used to doing these kind of things, but don't be afraid to really push in there a little bit to try to feel the tissues underneath as opposed to just touching yourself. And the third area that can compress on the nerves and blood vessels is going to be your first rib, which is controlled by the subclavius and the scalenes. Now, we already tested the scalenes, so let's test out the subclavius again with the tender test. All you're going to do here is find your clavicle, go underneath it, and press up into it as if you're trying to get behind it. And what you're going to do is run into a little muscle right there called the subclavius. And again, if it feels tender, tight, or recreates your pain, then that might be a positive sign that a little bastard is creating your TOS. Now, if you want to go above and beyond these tender tests, then I highly recommend checking out my free TOS training. In there, I'm going to show you some confirmation tests that we can do on top of these tender tests to not only see if they are fascially restricted, but they're also shortened and tight, which then creates your compression and your pain. On top of that, you're also going to learn my simple techniques to get rid of your pain in about 5 minutes. And I'm going to show you my simple blueprint on how to keep your pain from returning. To check that out, all you have to do is head over to tostreatment.com/training or click on the link in the description below. I'll see you over there.